tissue and normal tissue from the same patient. And so we thought, let's analyse those tissues because we can measure what's going on in those tumours. And let's see what we can measure. So this is Caroline grinding up a tiny piece of tumour, which you can see in the vague pink here, under liquid nitrogen. So we keep everything cold to keep it stable. And she has measured in these tumour the cells, the HIF1 proteins that it generates, and also vitamin C. So we've measured all of the things together in a patient in their normal tissue and in the tumour tissue to see, is there any difference? Are there any differences there? Well, I wouldn't be telling you this if there weren't. So what we found was that in high-grade tumours, so those are tumours that have a poor blood supply or a disorganised blood supply, that the amount of vitamin C is much lower than it is in low-grade tumours. So these tumours have more difficulty getting hold of the vitamin C that they have. But when we look at the absolute amount, and that's dependent not only on the type of tumour, but also on how much vitamin C that person might be taking in or what their normal plasma levels are, then what we see is the amount of vitamin C in the tumour affects the amount of HIF1 that's activated in that tumour. So tumours that had higher ascorbate content had much damped down levels of that HIF1 protein. We would expect that would have a positive benefit on tumour growth. So it would slow down tumour growth. And tumours that had the lower half, they had much higher activation. Now, because many of these samples have been banked, some of them for up to 10 years, we were able to do a retrospective analysis on the tissues that we analysed to see how those patients had done post-surgery. And so this is a result from our colorectal cancer study. So at this point here, the tumour was removed surgically. And so the patient's been followed up along that time. And what you can see here is that those tumours that had higher levels of vitamin C at this point, those patients did better with a much lesser number of patients presenting with secondary cancers or progressing on than the tumours that had low vitamin C. Now this is the first time that anyone has been able to do this analysis, and it's a fortunate coincidence of expertise and dedication. So we have dedicated people who have acquired this tissue, and also that combines with our expertise at being able to measure something in the tissue. So measurement is good. So this change, nothing to do with stage or grade of the tumour, was only dependent on how much vitamin C was in there. So we haven't manipulated this at all, but it's a good indication that what we might want to do is a clinical trial where we actually do an intervention so we can see if you give a patient more, is that likely to benefit?
It's already been done now.
To do that work. And so that's our hypothesis, that if we can have an impact on this region here, damp down that response, then that's going to slow the rate of tumour growth. And it will also help the rate of chemotherapy. So, vitamin C could be a useful adjunct to the current therapies that we have.